April.
Hi, my name is Kelly. I'm a Southwest Tech nursing student. I'm going to be giving you some shots today. I would pull the privacy carton, and can you please verify your name and date? Wash my hands. His name is Joe Smith, 9/19/87. I'm going to be looking at his wristband, and that's correct as well. I'm going to be looking at my doctor's orders and Lamar, and that is right. Smith of 19/19/87. I do have the correct patient here. And Joe, do you happen to have any allergies? Sulfa? Okay, so he only has sulfa allergies. So, wash my hands and put on my gloves. I'm gonna just go through before I do this. I'm gonna show you all the different places for the injection spots. So for the substantious injections are more of like for insulin. So you can do it back in the forearm right here, the tissue part in the thigh area, or you can do it in the stomach within 2 inches around the stomach. If you're going to go in 45 degrees on a person who has no fat, just go up like this and go in 45. Or if it's someone who does have fattier tissue, just go straight down at 90 degrees. So the IM, so the intramuscular area, one of them is going to be right up here. It's the deltoid. So I'm going to reach for, feel for his clavicle, left edge of it. 1 to 4 fingers here, put it down, and essentially it's going to be in an upside down triangle, and I'm going to be inserting my injection here. So that and that, and then the next one would be, so this one is actually going to be in here, and so right in here is the anterior superior iliac crest, and then back here is the iliac, this is the spine, and this is the iliac crest. So I'm going to have these right here, and right in between my index and my middle finger is where I'm going to inject my medication. And the next one, so this is the ventrogluteus area. So the next one would be the vastrolaterus. This one is going to be my hands right here, and they sort of split it up into thirds. So about right in the middle is where I'm going to be giving my injection. All right. And then for the TB shot, that's just given as an intradermal. So it's right underneath the skin, right on the forearm. So I'm going to be going through my medications right now. So the first one we're going to be given is the tuberculin purified proteins. That is a TB skin test in the forearm to test for TB. The skin will bleb when you inject it, and after 24 to 48 hours, you'll be coming back in to check to see the site of the TB if it's positive or negative. If it's positive, there's going to be a rash. It's going to be red, inflamed, and probably painful. So that's positive for TB. There are no labs for this, and that's what you would be assessing after that time period. The next one is the Novolog. The Novolog is going to be for the insulin. So that's going to be given in the stomach. That's where I'm going to do it for the sake of the video. It is a high alert drug, so I'm going to have somebody check over it. The class of it is a anti-diabetic, so I'm giving it to Joe, who is a diabetic. So I'm going to need to know what his insulin levels or what his glucose levels are before I end up giving him his injection. Obviously, I don't want to end up killing him or anything. And then, so this is going to stimulate the glucose uptake and inhibit the glucose production in a system, and it's rapid-acting insulin. Side effects is hypoglycemia, anaphylaxis, and some swelling. The lab monitor blood glucose every 6 hours, more frequently in ketoacidosis and stress, and A1C every 3 to 6 months just to verify that it's still effective on the patient. I'm going to be assessing for hyperglycemia, anxiety, restlessness, tingling in the hands and the feet and his tongue and lips, and a headache and tremor, and also hyperglycemia as well. And then also just sort of watching his weight too, if you're more of like in a nursing home. So that would actually be into here. So, but you can also put it into the side of the leg as well. Okay, so the next one, there is, and I forgot to, Joe, can you give me a rate on your pain? Is it right now? 8? Okay. So since he has an 8, he's going to be giving Demerol. Demerol is anything 5 to 10. So with Demerol, it is a opioid analgesic. So it's going to bind to the opioid receptors in the central nervous system, alter the perception and the response to the painful stimuli. And Joe, can you tell me when you happen to have your last dose? About 4.5 hours ago. Okay, so it's 4.5 hours ago. You can give it as needed every 4 hours. So I am okay with giving that pain medication to him now. It is to bring down his pain level. The side effects could be seizures, confusion, sedation, headache, hallucinations as well. For the lab, you may want to look at the, may increase the plasma on there. And then assess for pain level, location, intensity of the pain to and prior to the injection. Assess his blood pressure, pulse, and respiration before and after. His bowel movements as well. And then also, I'd probably come back in within 20 minutes to make sure the pain medication is working on him. So once I give it to him. And the next one is Toradol, which I'm not going to be giving. I'm going to be giving the other one, but this one is it's a non-opioid medication, but it's still a high-risk medication. So it inhibits the postglandian synthesis, which decreases the pain. So same thing. This is a 1 to 4 pain scale. Side effects is drowsiness, dizziness, heart failure, myocardial infarction, stroke, GI bleeding, dermatitis, Stevens-Johnson syndrome, toxic epidermal. Lab tests would be evaluate liver function, the AST and the ATL periodically, and for someone who is receiving prolonged therapy. So I'm going to be looking for this, I'm going to be assessing it in asthma patients. So rhinitis, urticaria, and then assess for rash during therapy or GI bleeding. All right, so my first one I'm going to be giving, I'm going to wash my hands, I'm going to put on my gloves. So I'm going to be giving the insulin, or not the insulin, the TB shot, the tuberculin purified proteins. I'm going to be doing it into the hot dog just for the sake of the video. So, all right, so I'm going to be starting with this. I'm going to be looking at my doctor's orders in the MAR. Okay, that's correct. Tuberculin purified protein. I'm going to be giving them 0.1 liters. That's correct. All right. So, and I'm checking this. So this is correct. It is the tuberculin purified protein. I'm going to mark that. And let's take a bit. I'm going to clean this. I'm going to clean it for 30 seconds in a circular motion. And for the sake of video, I'm not going to clean it for 30 seconds. So, same thing with the injection site. I'm also going to clean this in a circular motion for 30 seconds as well. So, next thing I'm going to do is look at my packaging on my my needle here, and just due to having to do this before it is open. But I'd be looking at this. It's not open. Nothing's been altered with it, so I can use this needle. So I'd be opening up the needle. And what I would do is then take the cap off. And since we're at 0.1, I'm going to pull down to 0.1 for air. And I'm going to put it right down into the middle of the vial. And I'm going to push the air right into it. So I'm going to pull up. All right, so I'm going to be looking at my MAR, my doctor's orders, tuberculin purified protein, 0.1. So I'm going to pull down on that at 0.1. All right, and the expiration date is correct, May 16, 2017, or sorry, November 16, 2017. And then again, tuberculin purified protein, my MAR, doctor's orders, and the expiration date hasn't expired, November 2017. This is not a high-risk drug, so I don't have to have anybody check it. The 5 rights to giving medication is the right patient, the right dose, the right drug, the right time, the right route. So I'm going to just take it one more time as my 3rd time with my MAR, my doctor's order. So it is a tuberculin purified protein at a 0.1. And I'm going to take it out of here. And then with the bevel up, I am going to be injecting it into the hot dog. So I'm going to be going in at about almost parallel. So at about 5 to 15 degrees, just right in underneath it, the epidermis, and going into it. And what it should do is when it's coming out, it will blab a little bit. You can sort of see it a little bit. And then I would sit here and wait and have me wait for 10 seconds before I end up pulling this out. So I pulled this back out, and then for the sake of the video, I would throw this away, but I'm actually going to reuse it, so I'm just going to recap it here. So I have this. So that is for the TB test. So for the insulin test, I'm going to be doing it on the orange here, but also I'm going to be doing it on this area and 2-inch area around the stomach. So, and for this one, it's a Novolog. So I'm going to be checking the doctor's orders. So I have Novolog right here. They're stating that it's going to depend on what their glucose is. So this one is going to be 10 units. So for their insulin. And this one is Novolog, not expired, December 2017. Now look, and this is my Nino for going into my insulin, 1 milliliter. So this hasn't been opened, hasn't been damaged, so I have opened it, but just for the sake of the video, it's not opened. And then what I'm going to do is I'm going to take the cap off. And they are requesting 10 units. So I'm going to pull down to 10 units. So, next part. Before I would do that, I would end up cleaning this for 30 seconds. And I would end up cleaning the site for 30 seconds as well. So, what I'm going to do is then put it down into here. Push the air down into it and tip it up. All right, so first check, I'm going to look at my MAR and the doctor's orders. All right, so this is a log, and it is 10 units. So there's no air bubbles or anything in here. All right, and it is for the correct patient, Joe Smith. And again, I'm going to check it, 10 units, Novolog, not expired, December 2017. For the Novolog. 10 units, and then this is a high-risk medication, so I'm going to have someone check this out. Can you verify this for 10 units of insulin? All right, perfect. So I'm going to do it my 3rd time looking at my MAR, doctor's orders. This is the Novolog for insulin, 10 units, and it is for Joe Smith. So I'm going to pull it out here. I'm going to go into this at a 90-degree angle. So I'm going to go right down into it like a dart. And then for every milliliter, you go down into it at 10 seconds. So this is down into it. I would wait 10 seconds, pull it out. So, and just for the sake of the video, I would throw this out, but I'm going to recap it if I need to use it again. With both of those two, I would end up going and documenting the information on those ones. So